Now you know a little more about chromosome problems. The next step is to learn about the test that can tell if your developing baby has this type of birth defects. Testing for chromosome problems is optional, so you can decide if you want this kind of information or not. In order to test for chromosome problems in your pregnancy, we have to get a sample of cells from the developing baby. There are two ways to do this, either by having a CVS procedure or by having an amniocentesis. The doctors who do CVS and amniocentesis procedures are obstetricians who've been specially trained to do these procedures. There are both male and female doctors who do these procedures, but to make it easier, I'm going to refer to the doctor as her for the rest of the program. We'll start with CVS since it can be done sooner in pregnancy. This procedure is usually done between 10 and 14 weeks in your pregnancy. In case you're wondering, CVS is short for Chorionic Villus sampling, but it's usually just called CVS. This procedure takes a small sample of the developing placenta. Since the placenta is made with fetal cells, we can test these cells for chromosome problems. So let's talk about how the CVS procedure is done. The first thing to happen during a CVS appointment is an ultrasound exam. The ultrasound is used to measure the size of the developing baby, check the heartbeat, and find the location of the placenta. Now there are two ways CVS can be done. The doctor decides which way is better for your pregnancy by looking at the ultrasound on the day of your appointment. Sometimes the best way to get a sample of the placenta is by passing a thin needle through your abdomen, usually near the bikini line, and into the uterus. The needle doesn't touch the baby during CVS. The procedure can be a little uncomfortable, and some women might feel a cramp when the needle enters the uterus. This is normal, but it doesn't always happen. It can take a few minutes for the doctor to finish getting the sample. In some pregnancies, there isn't an easy way to sample the placenta through the abdomen. In this situation, the doctor will take the placental sample by passing a thin plastic tube through the vagina. This way of doing the CVS is very similar to having a pap smear. Women usually feel cramping with this method too, but don't worry, that's normal. Just like the other method, it can take a few minutes to finish getting the sample. That's all there is with CVS. For the entire appointment, you'll want to plan on spending about 1 to 1.5 hours at the clinic. But remember, the actual CVS procedure only takes a few minutes. The rest of the time is spent getting ready for the procedure and having the ultrasound. There isn't much you need to do to get ready for CVS. Before your appointment, you'll need to have all your early prenatal lab work completed. On the day of your procedure, you can go ahead and eat your normal meals and follow your usual activities until the time of your appointment. You might be asked to have a full bladder when you arrive. You're encouraged to bring one support person to be with you during the CVS, but no children, please. Do you have any questions about CVS that you'd like to jot down?